These were all the concepts tested from dermatology subject in the year 2025 in UPSC examination. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack Derma DrMSD. So watch this video till the end to know all the important concepts which were tested, and these are also highly likely to be asked in FMGE, INICET and also NEET examination. First question, HPA Axis Suppression is going to result from which among the following options? So remember, if the glucocorticoids have been prescribed repeatedly within the previous year, that is the main reason for the adrenal insufficiency following the withdrawal of the corticosteroids, glucocorticoids. Next question, in the treatment of IBD, which is the Janus kinase which is used? So remember, it is tofacitinib. This is a JAK-STAT inhibitor, precisely JAK1, 3 and also JAK2 inhibitor. So next, 40-year-old man, case of chronic pancreatitis, came with the complaints of skin pigmentation over the abdomen, and there is history of chronic use of hot water bottle to relieve the abdominal discomfort. So what do you think is the answer? Yes, if you have thought of erythema ab ignae, you are absolutely correct. And this is how the abdomen is going to look clinically, which is going to have network-like pattern, reticulate pattern of erythema and also pigmentation because of the chronic hot water bottle usage. Next question, so you need to identify the subcutaneous nodules in the rheumatic fever. Related to this, the positive, correct statement. So they are present over the flexor aspect is a wrong statement. They are present over the extensor aspect. They are painful is a wrong statement. They are painless. And the usual size is not 3 to 5 centimeters, it is up to less than 2 centimeters. So we are left out with the last option. They typically appear more than 3 weeks after the onset of other clinical manifestations. That is a correct statement. I hope this is, we can say, a factual question. Next, Athraasma, this is a one-liner. It is due to Corynebacterium minutissima, which is going to produce on Woods lamp examination coral red fluorescence. I hope you know this point by this time. 32-year-old man presents with recurrent jaundice over the previous decade, and there is history of facial grimacing. Which of the following is the clinical clue? So Kaiser fissure in KF rings in the cornea. So adenoma sebaceum in the midface is seen in which disease? Yes, if you have thought of tuberous sclerosis, you are absolutely correct. Erythema nodosum, it is going to present with erythematous tender nodules present mainly over the lower extremities. So that is not associated with this condition. And Osler's nodes at the fingertip, they are classically seen in the case of infective endocarditis. So the answer is KF rings in the cornea. And what is the disease? If you have thought of the disease Wilson's disease, you are absolutely correct, right? Next, so this is a very simple question. Instead of image, they have asked you the description. So Mislines in the chronic arsenic poisoning. I hope all of you know they are the transverse white lines on the nails of the fingers and the toes, and this is the clinical picture. As you are able to see, these are the Mislines present over the nails. Very simple question. Next, this is another question related to leprosy. So type 2 lepra reaction is an immune complex mediated syndrome, and it is a Orthus phenomenon. This is absolutely correct statement. So statement 1 says type 1 lepra reaction is also called as erythema nodosum leprosum. This is a wrong statement. Type 1 lepra reaction is an example of type 4 hypersensitivity reaction. I hope you remember 1 plus 4 is equal to 5. 2 plus 3 is equal to 5. Okay. So type 4 hypersensitivity reaction is an example of cell-mediated immunity delayed type of hypersensitivity reaction. So erythema nodosum leprosum, dear students, remember it is the other name for the type 2 lepra reaction. So it is a wrong statement, statement 1. Lion faces or leonine facies is seen in the patients of lepromatous leprosy but not tuberculoid leprosy. Nose is not the last site, and in fact it is the first site of involvement in the patients of lepromatous leprosy. So option B is the correct answer for this question. Right, next question, 56-year-old gardener, so rose garden. Okay, so ulcerative nodule with purulent discharge on the right index finger. He had a prick with a thorn, rose thorn. So what is the diagnosis? It is sporotrichosis. Remember dear students, in sporotrichosis there is going to be nodular ulcerative lesions along the lymphatics in a linear fashion, also called as sporotrichoid fashion. But initially there is going to be a small nodular ulcer which is going to have a pus at the thorn prick site. Later on, through the lymphatics, these nodular ulcerative lesions will develop. So remember, the answer here is going to be sporotrichosis only, even if it is not mentioned that lymphatics are involved yet. Next is this question. 36-year-old is complaining of decreased appetite, there is mouth soreness, and there is diarrhea, the important clue, and also there is irritability, something related to central nervous system. Bright red tongue is there, and next is very important clue, there is pigmented scaly rash present around the neck. So which food items is the diet has a bearing on this disease? And if you have thought of the diagnosis as pellagra, you are absolutely correct. The reason is this pigmented scaly rash. The examiner is talking about the castle's necklace. And with these clues, I hope you have now understood what is the answer. Yes, it is corn. So remember, this is the castle's necklace, which is a pigmented scaly rash present due to the photodermatitis, which is seen commonly in the vitamin B3 or niacin deficiency, called as pellagra. And what is the basic problem? Corn is a maize, is the other name for maize, and it is closely associated with the pellagra. What is the reason? Because corn is deficient in tryptophan and also the niacin, which is going to produce a pellagra. Right? Next is one-liner. Acrodermatitis enteropathica is due to the problem in which of the absorption? It is zinc absorption is defective in these children. That is the reason why after 6 months, that is during the weaning period, there is going to be dermatitis changes which are going to be seen in the acral areas and also in the periorifacial areas. And what is the treatment? Lifelong zinc supplementation is going to treat these children. So next question is this one related to vitamin A deficiency. So repeated high doses of the retinol can cause liver damage and teratogenicity. This is absolutely correct statement. Acute overdose of vitamin A may lead to increased intracranial pressure and skin desquamation. Absolutely true statement. Excessive intake of carotene may cause harmless orange pigmentation of the skin. Absolutely true statement. Remember, regular vitamin A supplementation is not recommended for pregnant women in the countries where the vitamin deficiency is not endemic. So 3 is wrong. So we have to mark 1, 2 and 4, and the best option would be option B, 1, 2 and 4. So remember, this is the orange pigmentation which you are able to see in the carotene excess diet. Next is the one-liner. Kobner's isomorphic phenomenon can be seen in the disorders. I hope you remember this simple mnemonic: PSLV, psoriasis, lichen planus, V for vitiligo. So answer here will be option A, that is psoriasis. Okay. Very straightforward question. And if you look carefully, the other options, Behçet's disease, there was one question, leprosy, there was one question in this same paper. So this is the appearance of the morphologically similar looking lesions at the sites of the trauma. Kobner's isomorphic phenomenon. Next is a question related to human growth cycle, hair growth cycle. So remember dear students, ACT is the order in which you can remember anagen phase, catagen phase and telogen phase. Anagen phase is the active growth phase. It is this phase in which the length of the hair is going to be decided. Next is catagen phase. It is a transition phase. And finally we have the telogen phase, which is the resting phase, after which the hair is going to be shed off into the environment, which is called as exogen phase, and again the anagen phase is going to repeat. So this is how the hair growth cycle happens. So anagen phase is the active hair growth. Absolutely correct. Telogen is not transitional phase. Telogen is a resting phase. Catagen is the transitional phase. So option is A, that is 1 only, is the correct statement among the following. So next question is related to albinism, specifically oculocutaneous albinism. The disease results from genetic abnormalities leading to destruction of the melanocytes is a wrong statement. Okay. Type 1 albinism is due to the defect in the tyrosinase enzyme. Yes, absolutely correct. Because of this, melanocytes will be normal in the patients of albinism, but the melanin pigment is not going to be produced because of the defect in the tyrosinase gene. Patients may present with poor vision. There can be nystagmus and alternating strabismus. Absolutely correct statement. Patients are at increased risk of sunburn or developing skin cancer. Absolutely correct, because melanin has a protective role in the skin, and if it is absent, there is going to be high likelihood of development of the skin cancers and all. So correct answer will be 2, 3 and 4. Which one is the correct? Yes, 2, 3 and 4. So option D should be the correct answer. So this is a patient of albinism. Next, recurrent oral ulcer since 1 year, and there is a red eye and there are genital ulcerations. I hope by this time you have understood what is the diagnosis. It is Behçet's disease. It is Behçet's disease. And remember this pathology test, in which we are going to use a sterile needle and will prick the skin, after which, due to the abnormal immune reactivity in the patients of the Behçet's disease, there is going to be a development of the skin pustule or papule wherever the prick has been given within 1 to 2 days. This is what is called as a pathology test used in the patients of Behçet's disease, right? Next is this question. So just remember the answer: autistic spectrum disorders. So we have the tuberous sclerosis and also Fragile X syndrome, which are associated with ASD. So this is just a one-liner. Because there was tuberous sclerosis, I have put this question. Paper 2 question related to lymphedema. So remember, swelling will be there, burning sensation will be there, and also cramps will be there in the patients of the lymphedema. So 1, 2 and 4, the correct answer is option A. So this is a clinical picture of a patient of lymphedema. And one more question related to this lymphedema. Remember, we have the Kaposi sarcoma, squamous cell carcinoma, and also malignant melanoma, which can be disease malignancies associated with, again, lymphedema. So answer is going to be option A, 1, 2 and 3. Leukemia is not having association with lymphedema. Vibration white finger, this was a repeated question. Remember, in the individuals who are working with the jackhammer and chainsaws, they are going to have this white fingers because of the excessive vasospasm, as you can see in these patients. And this is a very important feature of secondary form of Raynaud's syndrome. I hope you remember Raynaud's syndrome. There is going to be 3 important color changes. What are those color changes? First, initially there is going to be whitish discoloration, followed by bluish discoloration, and finally there is going to be reddish discoloration. This order, white, blue, red, we call it as a Raynaud's syndrome, and very classically seen in the patients of those who are using jackhammers and chainsaws. Next is Amsel's diagnostic criteria. So I hope all of you know this is related to diagnosis of bacterial vaginosis, in which we have the vaginal pH more than 4.5, positive whiff test, and also presence of the clue cells more than 20%. 1, 2, 3 is the correct answer. Positive bacterial vaginal culture is not a criteria in the Amsel's diagnostic criteria. So these are the 4 aspects in which you have the homogeneous non-clumping vaginal discharge as one of the criteria, apart from the others. So daily suppressive therapy for HSV1 and HSV2. So remember, dear students, so according to the sources and also the Fitzpatrick, so you can, among the given options, mark option A, that is valaciclovir 1 gram once a day, or you can also mark the acyclovir 400 mg BD as the correct answer. But if you ask me, this question should not have been given, because valaciclovir 500 mg once a day is used when there are less than 10 outbreaks per year. But if there are more than 10 outbreaks, then we can use the 1 gram dosage. Outbreaks are there in the patients. So next question is pelvic inflammatory disease. Remember, Neisseria gonorrhea, chlamydia, and also Mycoplasma hominis, all of them are going to be the primary organisms in pelvic inflammatory disease, and that is the reason why in the yellow kit number 6, we have 3 medications which are going to target these 3 organisms. If you remember, what are those 3 medications? Metronidazole, we have cefixime, and we have doxycycline. Metronidazole is going to cover the anaerobic organism, that is Mycoplasma hominis, and Neisseria gonorrhea is going to be targeted by cefixime, and Chlamydia trachomatis is going to be targeted by the Yes, doxycycline. Okay, so these are the important organisms and the medications. I hope you remember this. So gynecology OPD, patient is coming with malodorous vaginal discharge. Again, vaginal discharge related question, very important topic. So discharge is grayish white and it is adherent to the vaginal walls. So what is the bedside diagnostic test? So remember, with all these clues, the diagnosis you need to think of is bacterial vaginosis, and among the following, obviously it is a whiff test, which is a simple bedside test which we can perform. So next question, cracked nipple. So correct attachment or latch will provide immediate relief from pain and also rapid healing will be proceeded. If pain, mother should use the breast pump and the infant is fed with express milk. Absolutely correct statement. Miconazole, which is an antifungal, topically used, applied over the nipple as well as baby's mouth if oral thrush or oral candidiasis is suspected. So all these statements 1, 2 and 3 are absolutely correct. Next, best drug for maintenance therapy of systemic lupus erythematosus during pregnancies. Remember, it is HCQs, hydroxychloroquine. This is a factual one-liner based question. Under NACO guidelines, RTI, STI services are provided with the SURAKA Clinic, and this is the logo, SURAKA Clinic, which is related to the sexual and also reproductive health services which are given under the NACO. So these are all the questions which were asked. If you have any doubts, you can ask me in the comment section. Please do hit that like button if the video is helpful, and also do consider subscribing this channel for getting the dermatology related videos on a regular basis. Thank you so much. Happy learning. Sarvam Sri Krishna Arpanam Sarvechana Sukhina Bhavantu.